When we feel our best, it's easy to assume our health is where it should be. But at times, serious conditions can develop without noticeable symptoms. So what should we do? What should we be asking our primary care provider? To help break down why annual checkups matter so much, we have Heather Prince, an advanced practice registered nurse from Mount Carmel Medical Group. Welcome, Heather. Great to have you.
Thank you for having me today.
Well, now, Heather, a lot of people think, hey, I feel good, I must be healthy. But you say that's not always the case, and that could be a risky mindset. Why is that?
Sometimes there's hidden things like diabetes, high blood pressure, your cholesterol could be out of control. Some of those things aren't physical, they would show up in lab work. So you think you feel good, but that might not be the case.
So that was just a couple of examples, but that's the tip of the iceberg, isn't it?
Correct.
There are many more conditions that we can have, but we don't know we have them. What are some other examples?
So the other would be like colon cancer. Also, if you haven't had your annual pap, a mammogram, there's other things that could be hiding as well.
Just to name a few more that I have here. Oh, COPD?
Correct.
Is another one. Thyroid disorder.
Yes.
So these are things that if we don't have any symptoms, it's important we're still in communication with our doctor or our primary care provider, right?
Correct. Because we can screen for those things earlier. You might think, oh, I just feel fatigued, but it could be vitamin D, it could be a B12, it could be an iron deficiency as well.
And that's what's tough. It could be as simple as, hey, we need a supplement in our diet, or it could be something much deeper. If someone feels healthy and lives a healthy lifestyle, are those annual screenings still important?
Yes, because genetics plays a role as well. So you could be very thin, very healthy, sleep well, but there could be some underlying things that we're not seeing.
Okay, let's walk through what happens for that annual checkup. What's the first step people should do?
So call and schedule, make an appointment. Then we come into the office, we have a conversation. So we'll talk about sleep, dental, eye exam, any concerns that you might have that you found out at Christmas or over the holidays that your mom is a type 2 diabetic or has glaucoma. Have you had an eye exam? Have you seen your dentist? So there's a lot of things that we can go over at that first visit to just try to get a baseline with you and then try to get some lab work done and do some annual screenings, and then hopefully everything looks well and we just see you once a year for follow-ups.
So that makes it important then when you ask about family history that we fill that out in its entirety.
Yes.
Paternal, grandfather, etc.
Yes.
All that.
Yes.
Okay, there's a reason for all those.
Yes, there is for those questions.
Okay, so I'm guessing those specific exams happen and testing, blood work, but we should also be asking questions to our provider, right?
Correct. If there's concerns that you have about depression, anxiety, supplements, that's a huge thing right now. A lot of patients want to know what can they do outside of their physical exams and lab work to stay healthy.
And about those supplements, should we be prepared to write all those down in the paperwork, or should we bring them in a bag so the provider can see exactly what we're taking?
I have patients that do both. I have some that have lists that they bring in, and then I have bags that they bring in, and either one is great, just so we have that information so we can have those conversations.
Okay, well, let's talk early detection. Yes. You mentioned that before. Why is it so important?
Anything that you can get at a preventative stage or early stage, there's always the options of what can we do to slow things down. When you come in and it's a stage 4 or 5, if we could have caught it at 1 or 2, there might be different treatments and courses and options available. So that's why the preventative aspect is so important.
So bottom line, we cannot skip those annual doctor's visits, can we?
Correct.
We've got to make time for those.
Yes.
Okay, and when it comes to finding a primary care provider, how can Mount Carmel help us, help our viewers watching?
So you can go to mountcarmel.com. There'll be a list of providers there. You can put in your zip code, so if you want to stay on a particular side of town. I also let patients know that asking friends or family if they're really unfamiliar on who to see or where to go, and then your insurance company also will have a list of providers that are in network.
Okay, one final message for our viewers who are watching, who are maybe putting those annual visits on the back burner thinking, I feel great. Any final words for them to motivate them to put their health more as a priority?
Yes, self-care is very important, especially if you're taking care of other people. You have to make that a priority.
Okay, very good. Heather, great advice. Thank you for being here.
Thank you so much for having me.